Well, good evening, everyone. My name is Dr. Robert Richard, and I'm a bariatric surgeon at the Longstreet Clinic Center for Weight Management. First and foremost, I'd like to thank you for tuning into our Facebook Live listening session today. We're here to talk to you about our various options for weight loss and how this team of hardworking, highly skilled individuals are here to help you meet your weight loss needs, not only today, but for long term. I'm here with Dr. Eric Velasquez, one of our bariatric surgeons, and I'm also here with the newest member of our team, an endocrinologist with a special expertise in obesity medicine and diabetes, Dr. Sonali Ganguly. Thank you guys for being here with me today. Well, for those of you out there who are Sure. For those of you who are less familiar with our practice, the Longstreet Clinic Center for Weight Management is a medical practice made up of a team of providers that focuses 100% of our time on weight management. That means all day, every day, we're helping patients lose weight and helping them manage it for the long term. We certainly do this in many ways. We have nutritional counseling with our certified dietitians. We have a medical weight loss program that uses high quality meal replacements, very low calorie diets, medications, and there's certainly a lot of new medications on the horizon today, as well as weight loss surgery. We're a full service bariatric surgical practice. We do revisional surgery as well as the gamut of surgery. So we're here today to talk to you a little bit about our services. But first, I certainly am happy to announce the arrival of our endocrinologist. And I'd like to start by asking Dr. Ganguly to kind of introduce herself to our Facebook family and tell us a little bit about yourself.
Sure. Thank you so much for the warm welcome. So as Dr. Richard mentioned, my name is Sonali Ganguly, and I'm the newest member to the Longstreet Clinic Center for Weight Management, and I'm so excited to have joined the practice. I'll officially start working at the beginning of September. So I'm born and brought up in the US, but have a little bit of an interesting history. After finishing all my training, I trained in Philadelphia and Pittsburgh. I actually moved over to Singapore for 15 years, which was a bit unexpected, but it turned out to be a great and very exciting adventure. In Singapore, I continued my work as an endocrinologist, and I worked in the largest government hospital there and actually led our Center for Weight Management. It was called the SGH, Singapore General Hospital Obesity Center. And I was in a similar kind of setup where we had bariatric surgeons, dietitians, physiotherapists, and nurse practitioners and endocrinologists. So I was so excited when I learned that I could find something similar here at the Longstreet Clinic, where, we have a multidisciplinary care team kind of treating obesity along the continuum from medical to surgical and everything in between. So yeah, very excited to join the team. Thanks.
So, endocrinology is a pretty good subspecialty. So what is it about obesity as a niche within endocrinology that kind of is your interest?
Yeah. So, what kind of got me into endocrinology was that I was always very interested in prevention. And there's a lot of room to do that in endocrinology because one of the main things that we deal with is diabetes. In addition to hypertension, hyperlipidemia, PCOS, which affects a lot of young women, which can lead to diabetes in the future. And, as it turns out, the root cause of a lot of these metabolic conditions is actually excess body weight, overweight, or obesity. So, again, coming back to prevention, if I treat the obesity, then I'm kind of treating all the medical conditions that stem from it. So that's really kind of how I got into it. Treating obesity, a lot of times it can lead to remission of diabetes. A lot of times the diabetes comes back, but now we have a lot of new medications that can help that. And, even if the diabetes doesn't necessarily completely go away, we all know that even a little bit of weight loss can certainly help better manage those metabolic conditions. And so that's kind of how I fit into this whole practice and puzzle as to how we help our patients.
Well, we're certainly glad to have you. I can tell you, I'm sure that everyone else that's watching can understand why we're excited about having you in our practice. Well, let's take a step back. So, Dr. Velasquez, why don't we start with, what's important about weight? Why is weight important to someone's overall health?
Absolutely. Controlling weight is very important because it affects every other system in the body. We know obesity is a chronic disease, and it's basically the accumulation of body fat to the point that it becomes detrimental to health. So as patients gain more weight, we use a number named the body mass index, or BMI, and obesity starts when the BMI is 30. So when this number continues to increase as the patient gains weight, the entire health of the patient deteriorates, and then they develop conditions such as high blood pressure, diabetes that we just mentioned, sleep apnea, fatty liver disease. So not controlling the weight can really lead to a lot of medical problems. Another important thing about obesity is the impact that it has on a patient's life. It has impacts that are implications that are to the health that we just mentioned. Also economic implications. We know that patients that are affected by obesity, they tend to have decreased productivity or to miss days at work. And this definitely affects their finances and also social implications. There is a stigma against obesity still in our society. So a lot of these patients suffer from discrimination, even sometimes to get a job, they don't get selected because of stigma due to the disease.
I totally agree. We often see patients that come in our door that's just been battling this problem for years. They may lose a little bit of the weight. They may come back. Can you talk a little bit about what factors may contribute to whether or not that person is going to become overweight and why they struggle with managing this condition?
Absolutely. So it's a multifactorial disease. The idea that we had in the past of we can fight obesity just by asking patients to eat less, we know that's not the way it works. It's multifactorial. So there are genetic factors, and there's not a lot that we can do on that end. We have the genes that we get. But there are other factors that are influential, like behavior, the level of exercises that patients do. Also diet, what we eat, when we eat, how much of it we eat. There's chemical factors and pharmaceutical factors. There are some medications that could lead to weight gain. And each patient has a different combination of all of these factors. And the beauty of identifying what factors are affecting a specific patient and being able to correct those that are modifiable are one of the things that we can offer in our practice.
Well, we always talk about weight management or weight loss. What are the health benefits of weight loss? What can a patient expect to as a result of weight loss?
Oh, well, you can see a lot of benefits in a lot of different departments. I'll tell you from my purview as a surgeon, patients that we do surgery, we see, for example, those that have obesity and type 2 diabetes. We see improvement of the blood glucose levels right after surgery. We check the glucose levels in recovery room, and they tend to be normal, have normalized. And a lot of these patients, we don't restart them on the medicine, unlike Dr. Ganguly mentioned. Sometimes they remain on remission for many years. Some of them actually can achieve cure depending on how long they're being affected by obesity. In the weeks to come after surgery, we see increase in their energy levels, being able to do more physical activity, having a little bit less of that daytime tiredness that patients experience. So it's an overall improvement on their overall health and also the physical and psychological.
So Dr. Ganguly, Dr. Velasquez mentioned a little bit about diabetes. Can you discuss this a little bit further as it pertains to a person who's living with the obesity and diabetes?
Sure. So it doesn't actually take a lot of weight loss to improve your diabetes control. Studies have shown that as little as 5 to 10% over 3 to 6 months can actually lead to better sugar control. So, when patients come in to see me, I first kind of have to talk to them about their goals. Are they wanting to lose a large amount of weight? If that's the case, then, you know, I talk to them a bit about bariatric surgery and see if that's something they're willing to pursue. If they really, you know, don't want to necessarily lose a lot of weight, but they just want a little bit better control of their sugar, we take a look at the medications. We try to, you know, make them more better for the patient in order to promote weight loss. There's a lot of medications, even diabetes medications, that can lead to weight gain. So we try to switch those around. But in those that do undergo bariatric surgery, like Dr. Velasquez mentioned, almost immediately go off all medications, usually go home on next to nothing, if not maybe just one medication. If they're on large doses of insulin, they may need a small dose of insulin when they go home. So each patient is very different, and we treat each patient as an individual. But definitely about 50% of them, the diabetes goes away. And if they're able to keep that weight off, the diabetes can actually be in remission for a long time. And even if it doesn't, even if diabetes is in remission for only 3 to 5 years, that's 3 to 5 years of very good sugar control, which also delays all of the complications that are associated with diabetes, the complications with the eyes, the kidney, the heart, stroke, all these things. So even just a short 3 to 5 years of better glycemic control can lead to long-term improved outcomes, which is so important when we're dealing with patients who've had diabetes for so many years.
That is such a great point. Matter of fact, you went on and explained my next question. So I think I'll move on to Dr. Velasquez. You know, as a surgeon, I get excited when we start talking about our procedures. So I'm going to give you the opportunity to at least talk a bit about the kind of procedures that we do for weight loss.
Absolutely. So our practice, and that's one of the beauties, the beauty of our practice, is 100% body weight loss. And our surgeons, Dr. Richard and I, and Dr. Damaso, we're 100% bariatric. So we don't do any other general surgery anymore. We dedicate our time 100% to the treatment of the a patient affected by obesity. And the procedures we do, they go from less invasive procedures such as the intragastric balloon and bariatric surgery such as the sleeve gastrectomy, the Roux-en-Y gastric bypass, and in specific cases, we can do even duodenal switches. So we offer all of the surgical procedures available for the treatment of obesity.
I totally agree. And, you know, we also do a lot of revisional surgery. I know some people out there don't understand that that is actually a thing. But there are a lot of patients that have had unusual surgeries out, you know, in the past, not just in the last couple of years, but over the last 30 years. And certainly we're the type of a surgical practice that has the experience to understand the long-term management of these patients. And some of these patients do truly need adjustments of their prior surgery. So having a practice where it is 100% focused on this one disease really gives us an advantage over a lot of other practices. I can also tell you that, you know, a weight loss operation can get good weight loss. But if you have a weight loss operation and a comprehensive team approach to the post-op management, where we actually have a patient develop significant lifestyle changes that they actually can continue for the long term, not only gets good weight loss, but gets excellent weight loss and has a much better chance of having that patient keep the weight off for the long term. So that's why in our practice, you don't just see the surgeon. We have dietitians that will help you on your journey. We have a complete medical weight loss team that will use body composition analysis to help you understand how you're losing weight and where you're losing weight so that we can do this safely. We can also use some of our meal replacement products that are of the highest quality with low calorie diets for augmentation of weight loss. We use medications. We have support groups. And as you can tell, we have all the tools in our practice for weight loss, and we will use them appropriately for the individual patient. And I think that's one of the beauties of this comprehensive center that we have. And with the addition of Dr. Ganguly, I think we're really getting excited about how we can add her services to the bariatric surgical patient. So how would you say your services as a specialized endocrinologists can really add to our comprehensive patient, post-op patient and the surgical patient.
Sure. So the interesting thing, I guess, about the way I've practiced for the past 15 years is that because I worked in a similar team, I've been involved with patients from the time they come in, before they've decided to go for surgery, to the time they actually decide to go for surgery, immediately post-op, and then long-term. And in a lot of patients who suffer from diabetes and obesity, there's a lot of medications that need to be adjusted during the very low calorie diet phase prior to the operation. A lot of times, the surgeons will say, this patient will benefit from a bit more weight loss. And so now there's a lot of exciting new medications that have come out that, we can use preoperatively to optimize a patient's weight prior to going for surgery. And then, of course, a lot of times, as we mentioned, obesity is a chronic disease. Even if a patient's undergone operation, there may be some weight regain. And that's another opportunity to, use medications to help them lose weight post-operatively as well. If the diabetes comes back or isn't completely gone after surgery, that's another area where endocrinologists can come in and help manage all of those metabolic conditions that go along with obesity, whether it be preoperatively or postoperatively. So I think, there's a lot of other medical problems. Vitamin D deficiency is something that's common in a lot of patients, actually pre and post-op. So that's something that we manage. We certainly look at people's bones to make sure they're not getting osteoporosis. So these are all kind of areas where endocrinologists can intervene and kind of contribute to the overall care of a patient with obesity.
I agree. We've talked a lot about how we focus on a team approach to our patients, but a lot of our patients have a primary care doctor that they've worked with for years. They've got an endocrinologist or cardiologist that they've worked with for years. So I guess I put this question out to Dr. Velasquez and maybe also for you, Dr. Ganguly. How do we integrate our team approach to the care that the patient's already getting, the patient's current care team?
Yeah, and we call this a multidisciplinary approach. And this starts from day one. Even on the first visit, like you said, a lot of patients come, given that this is a chronic disease and is usually associated to other conditions, they have, aside from their PCP, they may have already their cardiologist or the pulmonologist. And that's something that we find out on that first visit, and we establish right away communication with those other providers. And each patient is treated individually. So their workup is going to be custom tailored to them. And based on their conditions, we're going to decide who's going to be added to the workup or if something is not going to be needed. And this is in direct communication with their providers. We do it over the phone. We do it with letters. We ask access to the medical record so that we can integrate the care and do the workup so that to optimize the patient's health to the best condition prior to the surgery. And this continues even in the post-operative period, because as these conditions start to improve, the adjustment of the medications are done in coordination with their providers. In those cases that patients don't have a cardiology, but they do need one or any other specialist, our practice also has relationships in the community that we can connect those patients directly with those type of specialties.
How would you add to that, Dr. Ganguly?
Yes, so this is a tricky question because and it has come up in the past. So the way that I've worked with primary care physicians in the past, and of course I understand that a lot of patients have been with their own doctors for many, many years and they don't want to leave. I completely understand that. So is that maybe initially we're very closely involved with titrating of medicines before surgery and after surgery. And then once patients are a little bit more stable, I actually send my patients back out to their primary healthcare providers and maybe just check in with the patient every 6 months or a year, depending on how they're doing. If they're actually doing very well and their weight's been quite stable and all of their, comorbidities, metabolic conditions are well managed, I may just check in with them once a year just to see how things are going. If things are a little bit more tricky, it looks like diabetes may be coming back or the sugars aren't looking so great, we may need to see them a little bit more frequently. But this is something that, is kind of the same worldwide, so it's an issue that came up in Singapore as well. So things don't really change, no matter where you are. And so we're, happy to work and co-manage with patients' primary care doctors.
Yeah, I think that's an important point. We're going to co-manage. We want that patient to maintain that relationship with their primary care, and we actually want to maintain a relationship with their care team so that they feel comfortable reaching out to us if they have something that is unusual. Well, I'm often asked by patients, does my insurance cover the services? And I can tell you that's kind of an individual question. Everybody's insurance is a little bit different. I certainly want the patients to know that we have a team of specialists that understand the insurance policies of the patient. So if I've got a patient that's worried about that, certainly calling our office and talking to one of our coordinators, they'll be able to walk you through what your insurance covers and what it doesn't cover. Currently, this is an important time of year. Open enrollment's right around the corner. So trying to pick a plan in your insurance that does cover weight loss surgery is important. So this is the time to reach out. Just for an example, state health benefit plan, the state health benefit plan had not covered bariatric services for the past, since 2008. And last year they reinstituted that as in the plan, and they really haven't even advertised it to patients. So there are a lot of patients who are teachers or state health workers who have coverage and they really don't know about it. In fact, they even have coverage for medical weight loss, which is kind of unusual, and for some of the medications. So this is an important time of year. Make sure that you look at your insurance plan, try to pick a policy that will have coverage so that you can feel comfortable managing this condition. Well, what about that patient that's just sitting there saying, I've tried to lose weight before. What makes this program different? What would you tell that patient, Dr. Velasquez?
Well, I will tell them that we're unique, and we're unique because we dedicate 100% of our time to the treatment of obesity. We have acquired the skills and the expertise in treating this disease. Our practice has the opportunity of treating obesity in a comprehensive manner. It doesn't matter if the patient needs to lose just a few pounds or hundreds of pounds. We have a way of treating them. Our office offers, like you mentioned before, if it's necessary to do meal replacement plans. In part of the care, we have body composition analysis. We have the medically managed weight loss portion of the practice. We have the bariatric surgery. We do procedures such as the intragastric balloon. So it doesn't matter the amount of weight or the metabolic conditions or other comorbidities that the patients have. They can come to our practice and we can treat this in a comprehensive way. Another factor that is very important for us is education. Mm-hmm. We actually really spend a lot of time educating the patients, not only in obesity and the conditions that come with it, but also in adopting a healthier lifestyle and lifestyle techniques that will help them succeed in their weight loss and in maintaining that weight loss long term.
I totally agree, and I'd like to echo a few words. Weight management isn't something that you can learn in a day or go to a weekend course and learn. When I first got to Georgia, that actually is exactly what happened, and it caused some problems. When I first got to Georgia, there was a group in South Georgia that went to a weekend course to learn how to do gastric bypasses. They did 3 cases. 2 of those patients died. That gave us all a bad name in bariatric surgery. So for patients out there thinking about weight loss surgery or weight management, understand that experience matters. This team of professionals that we have here is a very experienced team that is very serious about dedicating their practice to treating this disease. I've been in town almost 20 years. There was my partner that I joined that is now retired, had been doing bariatric surgery for 15 years before I joined him. Certainly, Dr. Velasquez is a very experienced surgeon, and Dr. Ganguly didn't just start doing this. She's been doing this for 15 years. So you've got a lot of experience in this practice, and that type of experience just hard to find. So I certainly think that this is an unusual practice, and it's kind of, for me, it's the dream practice where I've got everything right here so that we can provide our patients the best care possible. I don't think there's anyone in the region that has what we have put together. So, this has been an interesting talk. We're getting ready to wrap up. I want to say, Dr. Ganguly, is there anything in particular that you want to talk about towards the end here as we wrap up?
No, just that, I think, as I mentioned earlier, it is a very exciting time in the field of obesity. Obesity has been recognized by the American Medical Association as a chronic disease. I think that was about 10 years ago. And I think that this kind of message is very important because, as Dr. Velasquez mentioned earlier, there is a lot of stigma associated with obesity, not only amongst the general public, but I will say even amongst healthcare providers. Mm-hmm. A lot of healthcare providers don't really either have the time or the bandwidth to discuss it. And yet we know that, obesity rates are going up worldwide, maybe fastest in the US. So I think it is indeed a really, really important and pressing problem. I think I'm always excited when, my friends, my non-medical friends or my non-medical husband or family members send me articles on, from the New York Times or, Wall Street Journal on obesity and how there's new medication. So I think it is, the word is getting out there that, this is really a serious public health issue that needs to be addressed. And I just feel very lucky that, I'm in a team that is just as passionate about obesity care as I am, a team that's experienced and ready to help our patients. So, I'm looking forward to working with everyone and look forward to helping people in Georgia and all over.
Well, I can tell you we're so happy to have you. I actually sent you 2 referrals today, so hopefully they'll get on your schedule soon.
Okay.
So, Dr. Velasquez, any last parting words?
No, I think it's been a really great conversation. I echo Dr. Ganguly's words on saying that we have to raise awareness about obesity. It's a pandemic, and really the more we talk about it, the more we are aware of it, more people are gonna know and decide to act on it and get it treated.
Well, thank you guys. Thank you both for being with me today, and thank you both for practicing with us here at the Center for Weight Management. So as we close, remember that care is available to you at 3 of our locations. We have a location in Gainesville, Brazelton, and Swanee. We also can offer telehealth visits, even for initial visits, and I think that's important because this is a far-reaching disease, and we have patients from out of state that will come to our practice for treatment for our comprehensive care. And we certainly want to accommodate those patients from a distance. If you are online, feel free to like, comment, and share this post if you found it information that will be helpful to you, family, and friends. If you have any questions, please do not hesitate to call our number at 770-534-0110. That's our main office number, or you certainly can reach out to us online. Again, thank you all for being here, and I hope you have a good evening.